All right. Well, we are at 1 o'clock. Mino Gijigad Hehana Washday, Buju and Dinaway Maganado, Misty Woki Indigenous, Makwa and Dudam, Mikanakwa and Dunjaba. My name is Misty Wilkie, and I am Bear Clan from the Turtle Mountain Band of Chippewa Indians. And on behalf of the University of Minnesota School of Nursing's Center for Indigenous People, Health and Nursing, I want to welcome you to the second in a series of incredible speakers that we have lined up for the month of November. I invite you to fully engage this month and commit to learning about Native history, health, and people. There will be a variety of events in your local communities, and I encourage you to attend one or several. One of the incredible things about Native communities is we're always willing to teach and share our culture for those that are interested in learning. A couple of housekeeping items I want to address before we get started. When Anna is done with her presentation, we'll open it up for Q&A. So if you can put your questions in the Q&A box, I will read those aloud, and then Anna can address those as they come in. So I'm happy to introduce Anna Negrete. She is the community planner for the Department of Public Safety's Missing, Murdered, Indigenous Relatives Office. She works to raise awareness, train across multiple systems along with her team, and collaborate with stakeholders to strengthen the state's response to the missing and murdered epidemic that was documented in Wilder Researchers' MMIW Task Force report to legislators. She has more than 25 years of experience working within the juvenile justice system in various settings, including her work as a probation officer and addressing systemic racial disparities. In this new role that she's in, her work as a probation officer and addressing systemic racial disparity. Oops, sorry, I already read that. In this new role, she hopes to develop relationships with various partners throughout the state to address the root causes of MMIR injustice. She hopes to support existing community lead efforts, engage with those impacted by MMIR, and collaborate with agencies working to address risk factors which lead to vulnerabilities for MMIR, and to elevate voices and raise awareness, and to push for systemic change. So with that, I want to thank you so much, Anna, for taking the time to share your expertise with us and see how we can help bring awareness and work together on MMIR. So I will leave it to you. Thank you.
Thank you for that introduction. Good afternoon, everybody. Thank you for joining on this beautiful fall day. My name is Anna Negrete. As Misty indicated, I am the community planner with the office. My background, she outlined a little bit, but on a personal level, I am Otomi from the northern part of Mexico. That's where I get my indigenous roots. My husband is from Spirit Lake, and I have Ho-Chunk children. So lots of connections with the community throughout our family. I started with the MMIR office back in 2020. Gosh, it's going to be 2 years here in February of 2025. It'll be 2 years that I've been with the office. Our office was created back in 2021. Our director started. Director Julie Rudy is our current leader. And I'll go through a little bit more about the various roles within our office as I go through the presentation. So how our office was created, as Misty indicated, the MMI, actually it's the MMIW Task Force report was started gathering together. The task force started getting together in 2019 to address the disproportionate rate of missing and murdered Indigenous relatives in Minnesota. They finalized the report in 2020, and it was released to the public and to the governor's office. Mandate number one of the report, and I'll go into different mandates and how they pertain to potentially your roles. But mandate number one was the creation of our office. And so Director Rudy was hired and came on board and developed staffing models. What is the MMIR Injustice, MMIW Injustice in Minnesota? Some highlights of kind of what this research showed was that the American Indian population in Minnesota makes up actually 1.4% of the state's population, but for Indigenous women and girls, 8% of the homicide rates from 2010 to 2018 were Indigenous women and girls. On the missing aspect, they also looked at data from 2012 to 2020 and found that during that time period, an average of 27 to 54 Indigenous women or girls were missing. That number in recent years has trended upwards. We are more along the lines of 60 folks missing on any given day in Minnesota. And so the need for our office and the work is clear for our office and clear for our relatives. That task force report was really instrumental in developing, not only calling for the development of our office, but really talking about what the root causes for MMIW injustice, MMIR injustice. And I apologize, I'm going back and forth to elaborate a little bit on that. The MMIW task force looked at impact of not only Indigenous women and girls, but men and two-spirit individuals. And so as we developed our office, the acronym changed from MMIW to MMIR to reflect the fact that men and two-spirit folks also had disproportionate rates that they went missing and are murdered. So I will go with MMIR now, since that's my wheelhouse and how we refer to our population within Minnesota. The root causes that task force really helped us identify was at the beginning of MMIR happened as soon as colonization began to occur within our lands. It was intensified by historical trauma, including things like boarding schools, but also impacted by racism, sexism, and sexual objectification of Indigenous people. What you all will see in the work that you are doing in various nursing, or if you're in the community, symptoms or risk factors that we see on a daily basis include things such as poverty, housing insecurities, involvement in both the child welfare system and the juvenile and the justice system, substance use disorders, intimate partner violence, human trafficking, and sexual violence. We often hear about the rate of how all these risk factors impact our relatives. And so as we talk about missing and murdered Indigenous relatives, we really start to look at how each of these systems impact our relatives throughout the state of Minnesota. As our office was developed, we really referred to that MMIW report, and they had some pretty lofty goals set out for us. They asked us to really address the systemic causes behind the disproportionate violence experienced by Indigenous women and girls, collect data and report on violence against Indigenous women and girls, look at policies and practices and institutions that impact violence, reduce and eliminate violence against Indigenous women and girls, and help Indigenous women and girls as well as survivors and their families and communities, prevent and heal from the violence. So we had some pretty lofty goals early on. From that, we started to develop a mission and vision. The MMIR vision is to reduce and end violence against all Indigenous relatives in Minnesota. And the mission of our office is to develop and implementation of systems, legislative, transformative social policies paired with applications and sufficient resources, programs, and services that foster safety, equity, healing, civil and human rights, of Indigenous people and communities in Minnesota. Again, those are all really big words that we break down and tackle on a day-to-day basis as we address this issue as a state system. Additional findings of that report really talk about the impact. Once an Indigenous relative goes missing or dies under suspicious circumstances, the investigation, prosecution, and sentencing process that are supposed to serve as justice help serve often fail to provide equal and fair treatment for the investigation for Indigenous victims. The system does not adequately have cultural responsive healing resources for Indigenous victims and survivors, as well as communities. To talk a little bit about the mandates and some things that you may see within your system, within your work, and the need. What brings me here today is really to ask for partnership, to look at ways that we can work collaboratively together. The MMIW task force report didn't only offer recommendations, but they really called our state to mandate some action. They came up with 20 mandates, and I wanted to highlight a few of those for you. As I look at mandate 3, which is to address systemic racism, I feel like that's a generational lifetime achievement goal, but we need partners from all areas of service. We also hope to expand Safe Harbor for all. Safe Harbor at this point works to decriminalize human trafficking, which, as we mentioned, is a risk factor for MMIR. Right now, that protection is extended for young people up to the age of 24, but we would like to see that expanded to include relatives of all ages. Mandate 12 also talks about ensuring that MMIW-related deaths receive autopsies and are investigated by either a coroner or medical examiner. As they looked at the various research, that was one of the key factors that we're missing as we talk about really understanding the causes of death. So often when we talk to families and connect with families, or as families are reaching out, we hear about deaths within Minnesota of Indigenous people being miscategorized, whether the cause of death is dismissed as an overdose, hypothermia, exposure to elements. Families really are struggling with those type of answers that really don't do the cases justice, and families are questioning the results of how deaths in Minnesota are classified. Mandate 13 talks about strengthening trauma-informed victim-centered responses of law enforcement. Sorry, part of my slides are covered up here by our presentation, so let me move that here. Mandate 13 talks about strengthening trauma-informed and victim-centered responses of law enforcement, courts, and healthcare systems to Indigenous survivors of sexual assault, trafficking, and violence survivors. So I bring that to you today. It's really where I highlight some of these today is really to let you know that we can't do this work alone. We do need systems partners to engage in this work and think creatively on how we can work together to address this epidemic in Minnesota. In year 1, as I mentioned, Director Rudy was tasked with not only starting to serve the community, but also to develop a staffing structure. As she looked at the various mandates and how they impact MMIR in Minnesota, her first thought was to engage with a community planner, which is my role. This role is responsible for community engagement, awareness, and supports to do some cross-training presentations like this. The second role that she found was really important was to really focus on violence prevention. And so she hired a violence prevention coordinator, Tani Smith-Savage, was responsible for another level of engagement. She works to help identify system gaps, provide additional trainings and resources, talk about violence prevention, healthy relationships, boundaries, and consent through curriculum such as Libet that she presents to youth in the community throughout the state of Minnesota. The third role that was hired was the intelligence specialist. And Taylor Wenzel is responsible for data collection, technical assistance for law enforcement, including relationship building and ongoing training with various providers. How that's impacted the medical field in particular is that various MEs throughout the state have started to reach to us, not only to help identify unidentified relatives who come within their care, but also to contact tribal nations to help connect with families who they are struggling to when they're struggling to notify next of kin when deaths happen. In our first year, we had just those three roles. And what ended up happening is that families came forward asking for support. Initially, we developed the role, which was called the family support liaison, and later developed into the victim specialist. And that role is responsible for supporting families in different stages of being impacted by MMIR. For many families, they reach out to us sometimes before they're reaching out to law enforcement to report their relatives missing. So we walk them through helping make that initial missing persons report to ongoing advocacy throughout systems. Again, one of the things that we often hear when we're working with MMIR impacted families is that there's a big lack of communication. Families report they can go months and sometimes years without hearing from law enforcement on any active efforts to locate their relative. And while in some of our long-term cases, we understand that there's no updates, but we really want to encourage law enforcement departments to check in with families, even if it's to say that they don't have any updates, but let them know that their loved one is still, their cases are still being looked at, and that there's still some ongoing efforts to locate their relatives. The victim specialist and the family support liaison roles throughout our office also help with death investigation processes. And I'll get a little more into that as we talk about some of the awareness and some of the other work that we do. But this is a general outline of our current staffing structure. We hope in 2020-25 to also include a new staff member that will be responsible for case review coordination. And so in some of those more long-term cases, really having somebody take a look at those cases, see if there was anything that was missed in the investigation, and work with law enforcement collaboratively to really address some of those, the areas of investigation and support law enforcement in their work. As a community planner, there's many ways for us to engage with the community. One of the formal ways that we engage with community is through our MMIR Advisory Council. This 20-member council is chaired by Monty Frank, who has lived experience as his daughter was missing at one point and later murdered. Impacted families are also seated on the board as well. Informed system partners were critical as we developed the MMIR Advisory Council, and various representatives from different systems have joined that committee. That includes folks that do direct service, provide advocacy, have equal law background, law enforcement service providers, and other partners that really can advise our office on directions we can go and things that we may be missing. The second way that we engage with community on a formal level has been the Gagi Gay McWindigo Ziwag Reward Fund. The seven-member reward fund group is chaired by Nicole Matthews, was the original chair from the MMIW Task Force report. We have included members of the Human Trafficking Task Force, law enforcement representatives, legal advocates, and together we have developed a few programs that we will soon be announcing, including a tip program that will be offering up to $10,000 on 15 cases right now that are eligible for the $10,000 reward that leads to resolution of cases on long-term missing and homicide cases. this reward fund also will support awareness campaigns and supports search efforts. When I came into the office, I really thought as a community planner, I would be doing some things like someday going and organizing a gala or being in community tabling, doing presentations. And while that's part of my role, what the community has also really said is that we need boots on the ground folks looking for our relatives. In September of 2023, we engaged in our first large-scale search for long-term missing case of Nevaeh Kingbird. This past October 22nd, she hit her 3-year missing mark. Nevaeh went missing at the age of 15, and this year she would be graduating from high school, and in August had her 18th birthday. While the MMIR office hadn't been created at the time that Nevaeh went missing, we were fortunate enough to engage with that family early on. Meeting Nevaeh's mom has really impacted me personally and really helps me staying connected with her, helps me understand the needs of the family. Nevaeh's mom talks about searching that didn't happen. Nevaeh was initially reported as missing by her mother. However, the case was categorized as a runaway, and active search efforts didn't start until 2 months after that she went missing. As you can imagine, being missing in October and having searches begin in November when there was snow on the ground presented particular challenges. Some background around Nevaeh is that she did have a history of running away. On the night that she went missing, she was with a group of teens. She had a history of mental health and was under the influence at the time of her disappearance. I don't say any of those things or list any of those things to stigmatize or blame Nevaeh or her family for what has happened to her, although we don't know the answers. But I really wanted to highlight those things because as we started to identify those risk factors, I wanted to point out an example of how many of these risk factors Nevaeh had. Nevaeh didn't have a history of chemical use. However, prior to her disappearance, within the month before she disappeared, she had a friend that had died by suicide. That drove Nevaeh into a deep depression and resulted in chemical use on the night that she disappeared. At the time, as you remember, in 2020, COVID was running through our state, and Mom was unable to go out and actively search immediately after because her family, including several children, were homesick with COVID. Levels of informal engagement do include some of the things that I thought I would be doing, such as trainings, presentations, and being in community. Oftentimes, hopefully you have seen us at various community health events, including public health events, community gatherings, powwows. We provide educational presenting both statewide, nationally. And this past July, I had the opportunity to travel to Canada to do some cross-border collaboration in the Winnipeg area on the overlap of MMIR and human trafficking. We really strive to be in community because what we're realizing is that showing up matters. We want to not only provide information and work with different partners to build collaboration, but we want to bring those resources back to Minnesota so we can better serve families and make a dent in impacting the epidemic of MMIR. Why does awareness matter? Why community presentations and presence are one aspect of the work. What we really want to do while we're out in community spaces is letting families share their stories in a way that does not re-exploit their trauma. The picture on the screen is of the February 14th event that has happened for more than 10 years in the Minneapolis area. And in past, we've had the pleasure of having some dignitaries come and speak, including Senator Kunish, Governor Peggy Flanagan, Commissioner Jacobson the Commissioner of the Department of Public Safety. And this year, while we had several dignitaries speak, we also really tried to empower the families to speak. The family of Kateri Michelle was able to speak this year for the first time, and she has been missing for more than 15 years out of Minneapolis. The family of Nevaeh Kingbird spoke, the family of Mato Dow spoke, and several other relatives that were impacted. The reason why we really want to engage the families in speaking and telling their stories comes from some advice that our office received from Patty Wetterling, the mother of Jacob Wetterling. She really talked to us about making sure that people knew who our relatives were, not just their names, not just a face, but something more personal about them. I know I was about the same age as Jacob when he went missing, and it really started to change how communities responded and cared for their children. We kept a closer eye. We started to limit how free our children moved about the community. But Jacob Wetterling became a household name. As I talk in different community spaces, I often ask the question, how many of you have heard of Gabby Petito? And most of the hands go up. When I start to talk about the names in Minnesota, and I mention people like Sheila St. Clair, Jojo Boswell, Mato Dow, Jeremy Jourdain, and other missing, and ask how many people have heard of those cases, it's always a little disheartening to hear how few people have heard of those cases, despite those cases being cases out of Minnesota. What families have really said is that when somebody goes missing from their family, whether it's missing in unknown ways or due to homicide, they are missing in three ways, not only from the families and community, but also in the media and in the investigation process. As I started to learn and connect with more families, one of the stories that really sticks out in my mind is the story of Kateri Michelle. The day that she went missing, mom reports that she made the report and that she waited to hear some information. She thought there would be some type of response. She turned on the news. She waited for the community to respond. She thought that her daughter's story would be represented there. What she remembers happening instead is that on the day that she went missing, there was a car crash. And during that car crash, there was a dog in the car, and the dog had escaped the crash. And the community, instead of looking for her daughter, was looking for the missing dog. That was really hard for her and something that she has held for many years. And so we talk about the importance of awareness. We really want to commit and support families. And so we encourage them to tell their stories so folks can learn more about the impacted families and more about the individuals that are missing and murdered. We are stronger in community together. What you'll see on this screen is some of the results of various collaborative efforts within our office to bring more awareness. Clear Channel Communication this past year donated space on digital billboards across the metro, including 2 in Minneapolis, 1 in Burnsville, 1 in Mounds View, 1 in Maplewood, and Columbus Township that are currently highlighting, I believe it's 13 cases. At the top, you'll see Leo Coleman Cortez. He has been missing for more than 40 years out of the city of Anoka. Below, you also see Nevaeh's billboard. And again, she has been missing now 3 years. While we're fortunate to engage with some partners where they are offered as PSAs, the reward fund that was developed will also serve to raise awareness and put up more billboards in impacted communities. We don't just want to have them in the metro. We do want to move some of those billboards to more impacted areas such as Bemidji, Wadena, Anoka, Detroit Lakes, and other cities where some of our long-term missing folks went missing out of. The other thing that the reward fund will support is search kits. Search kits were developed in February of 2023, after a young man was missing out of the Mille Lacs community. What was clear from that initial search that we were involved in is that communities needed more tools and resources. I began my role on February 1st, and by the end of February, I had engaged in my first search out in that Mille Lacs community. As you can imagine, and as you know, in Minnesota, snow impacts those searches. I believe it was close to 4 feet of snow that we went through to look for one of our relatives. And what I realized is that we needed to do better. I witnessed elders coming out, people of different ages and abilities came out to really try and help resolve these cases. We didn't have what we needed. We were breaking off branches to make our way through snow. It was hard to understand who was on the search and who were kind of passive bystanders who were just watching what we do. And so we developed search kits, which now are placed regionally throughout the state of Minnesota, including Mille Lacs, Red Lake, Fond du Lac, Lower Sioux, and one kit to be retained in the Twin Cities area to support searches for relatives throughout our state. Those search kits include things like walking sticks, high visibility vest, GPS devices to track where searches are, what search areas have been covered, communication two-way radios, and then seasonal items such as hand warmers, bug spray, realizing that we'll be searching in different weather conditions. And so we wanted to make sure that those things were there. Not only that, but the other piece that we really wanted to make sure that was included was cultural medicines. And so with those search kits, items such as sage, cedar, sweetgrass are also included as we search for our missing relatives. The call for collaboration. Our office really wants to listen, learn, and collaborate. And so we move through different community spaces, meeting different people. We presented all over the state with all types of different system stakeholders, whether it's healthcare professionals, friends of the Boundary Waters, retired principals, youth, tribal nations, urban Indian communities. We really want to take the opportunity to listen and understand the needs so we can do better. We want to partner with people that are and communities that are impacted by MMIR, as well as those who have been doing the work long before our office. Like I mentioned, our office will be 3 years old this coming February, but we want to recognize and acknowledge many of the agencies who have been doing the work long before our office was created. You all as healthcare providers see the symptoms of MMIR before they come to our attention. We encounter the aftermath, but together we can make a difference to reduce and end violence in Minnesota. Many times we get this question, what can we do? Professionally, as I thought about folks in the healthcare system, I wanted to highlight some of my thoughts. Consider the mandates. On one of the last slides, you'll see a link to our office where you can find the full MMIW task force report, which highlights those 20 mandates. But consider those mandates and how your roles are impacted by that. Reach out to the MMI office to collaborate. Let's find creative ways to work together. If you're a direct service provider and you come across families who need our support, please feel free to make that connection. I don't think there's been a time that I've been out in community where somebody came to our table saying, my family member was murdered, or I have a relative that is missing. I really want to continue to talk about those risk factors. And so it's important as we talk about MMIR to have healthcare providers understand those risk factors. Attend MMIR council meetings. Both our advisory council and our reward fund meetings are open to the public. So if you have the opportunity to attend, please do. Those meeting links can be found on our website. Continue to advocate for systems change. Like I mentioned, we can't do this work alone. So if you see things that need to be changed and have some possible solutions or want to talk things through, please reach out to our office. One of the key images or symbols of MMIR is the red handprint over the mouth. You'll see that on our logo. What I ask of you today is to participate in destigmatizing the culture of silence. I know as I grew up in my own household, silence was expected. We didn't talk about what was going on in our house. If there was domestic violence or sexual violence, abuse, poverty, that is not something that we talked about. So I want to encourage everybody to start to destigmatize that culture of silence by modeling that. In a presentation I was doing in the Lower Sioux Indian community, one of the best pieces of advice I heard was an elder who really said, not only is there a list of things that you can do, but personally, what we need to do as a community and individuals is to heal. Model that by promoting healing. Some simple things that you can do is share social media posts regarding MMIR when you see them online. Help dispel the myth, help dispel myths that impact MMIR. What I hear oftentimes from families is that they're told they need to wait for 24 or 48 hours. By law, Brandon's law in particular, there is no waiting period to report a person missing. You can call 911 in any jurisdiction. I talk to families often who are out of the area and they're concerned they're up north or down south and have relatives missing in the Minneapolis area. They're often trying to call Minneapolis PD, and what we tell them is you can call 911 in your own jurisdiction, and law enforcement must take that report. When it comes to the investigation piece, law enforcement will redelegate, but you can call and make that report by simply picking up the phone and calling 911. I encourage you to engage and attend public awareness events, attend searches in the community, ask questions, and to be a good relative. If you're able, there's opportunities to donate in various ways. Why that could be things such as financial donations to the reward fund, but also donating your time when there are searches in your community or when we're asking for items to support searches, such as food or water. There's plenty of opportunities and ways that you can donate. Please feel free to reach out to our office as you see those things happening in our community and need ways to connect. I was so very proud, and I can't tell you how excited I was to see that in February of this past year, the MMIR specialty plates were released. Every time I'm in community, I smile when I see those plates, knowing that $25 of the purchase of those plates goes back into the reward fund to support families in need. I feel like I walked through that pretty quickly, but I wanted to open it up for some time to answer questions.
Oh, thank you doesn't seem like enough, Anna. That was really heavy. And I have a couple of questions for you as folks write their questions in the Q&A chat. But thank you from the bottom of my heart for the work that you do and your office. So my questions are, I have two. How do you do self-care? with the work that you're doing every day. And my other question is about, I know Minnesota is a progressive state, and so I'm wondering if you work with other states that are interested in creating a similar office within their states.
Yeah, self-care wasn't something that I realized I would need early on. I wanted to jump in with both feet. It was hard for me to, as I connected with families, to turn off the crisis mode. It's hard when we're out in community spaces to take some time, but that is exactly what we need to do. I'm thankful to have faith as part of the tools in my toolbox, and so I'm often smudging. I think that was one of the key factors, including of making sure that we included those things in search kits because the work we do is heavy. And as we talk about staff development within our office, that is self-care, that is making sure that we take some time off, time to reflect and acknowledge the secondary trauma that happens as we work with families. The first funeral is hard. First time that we recover relatives, those are hard. But the second and the third times don't get any easier. So it is important to set some boundaries, to disconnect, to take time to smudge, and to take time to even access mental health support when we need it. And so those are important aspects that I've incorporated into my own self-care. As far as collaborating with other states, it's funny that you mentioned that. Next week I'll be up in Spirit Lake Nation, assisting with a search for two missing relatives in that community. We realize that we are the first state in the nation to have an MMI office. And so when we have the opportunity to support other nations, we do try and do that. Last month, we had our first national convening in Phoenix, Arizona, where we met with folks around the nation doing MMIR, or in some nations, MMIP or W work. And so together we came together to talk about some of these common challenges that we face and how some of our states have overcome those. We are fortunate in Minnesota to have this office. Several of the states are an office of one, and we can't do this work alone. I can't imagine being in a state like Arizona and being an office of one. And so we do try and share knowledge whenever we're asked, and take opportunities to support each other as we go into this work.